and welcome to the Nurse Rosa's Insight podcast. I'm your host, Rosa Hart, and today I'm here with Jean Ross. And the purpose of the Nurse Rosa's Insights podcast is to spotlight healthcare stakeholders who see a need in their community and are either meeting it or have a new idea of how to meet it, and kind of just get that idea out there into the universe, because collaboration is power. And as nurses, I think it's really great when we can collaborate instead of competing. And we can just, like, a lot of the times at the bedside, Jean, I'm not sure, we didn't talk about this ahead of time, but I know a lot of the time we would ask each other for advice and say, well, if two nurses agree on it, it's probably right. Does that sound like solid plan to you?
I love it. No, and I love that you have a neuro nerd shirt on. I have dementia friends on mine. So we're both like brain geeks.
Yes, exactly. So Jean, we met through LinkedIn because you have created a new platform called Primary Record. So can you tell us real quick, what is your brainchild, Primary Record?
Oh, so Primary Record's the thing that everybody's been wanting to build, but it hasn't been built by a nurse yet. So it is a platform or application that lets families take all of their family members and take all of the patient portals and basically finally have that one place to dump their health information. And not only can we collect it, but then we help families use that data to share it to their healthcare providers, have family members inside of there so they can share the workload, as well as use AI to let families ask those questions and get those answers really quick when they're in that moment and they have like that 2 minutes with a doctor. So we have built my dream application for families as a nurse.
So let's define this a little bit. So it dumps the healthcare information from their charts in various places all in one location, like we would take our papers and dump them in a file folder, right? But
Correct.
then how does
it
get sorted? Is that where the AI comes into play?
Yeah, so we actually kind of the first thing we lead families to do is there is a new law on our sides that one has created everywhere we go. I don't know if families are noticing, they're getting handed a patient portal. And it's wonderful because we can access the information in that system. But as families move around or get bigger, they start realizing, oh my gosh, I now have 20 patient portals. And so our application lets those families connect the portals for each family member to download that data out so that they can own it in their own primary record. And then as well as they're getting handed papers, or we've built in even an audio record button. So as they're at the doctor's, they can hit record and it'll transcribe. We just think of all the things that families are getting information thrown at them. And how does our app help families? So our whole goal is to simplify health information for families. And so it's having that one place, and then it smartly organizes the information for them in their medication list, condition list, keep track of their doctors. So, and we all have the binders and the file folders. This is just the electronic version.
And it's so much better than that too, because so in my role as a navigator, I have activated patient records through MyChart, which is the platform that we use. And I love that. I have to kind of sell it to people who don't want to necessarily fool with another app or learn how to use it on a website, or they're just intimidated because it's something they haven't done before. And but having their own information is so powerful, especially if they have access to see their labs and know, oh, my hemoglobin A1C was 11, and then they go see their endocrinologist who's in another system and doesn't have access to our records. They can pull that up and show it on my chart and maybe prevent having to draw another lab in order to get something done. And so it's been really great to utilize those health records. But for stroke patients, which are what I deal with all the time, aphasia is a big problem, for example. Yeah. So maybe the patient themselves, even if they have a MyChart, maybe they can't read now, or maybe they can't speak now, and they need to give access to their spouse or their child or something like that. And that can cause a huge delay in care if they're is a problem with that getting signed over. And so if it's already connected and your spouse or your children already has access to your health record, if you're comfortable with sharing that with them and you trust them and you would anyway, then it saves such a huge delaying step.
Yeah.
Here,
No,
especially for patients.
and that's what we have found, because that's kind of a little bit of like what I saw, in my journey as a nurse, families, as nurses, we always want our families to be engaged. And I used to kind of like wonder, like, why, like, we kind of blame them, like, oh, the family's not around, they're not engaged. Well, they're working. They're trying their best to like help support this person at home. And you cannot believe as a nurse when I started like following families out in the community, like how much they like turned to that loved one and was like, give me the update. And then they couldn't recount it or they couldn't share the information. So the family's just lost. And so that family centered piece was so crucial at Primary Record. And we've set it the way so like you get to share to the level of your comfort. So like my mom lets me view certain things and doesn't let me have access yet. She's just not ready, and that's her right. But when she needs my help and support, Primary Record's there in place so that she's keeping track of information and I can jump in and support her when I need to see the full picture. And I'm happy with that. Well, obviously the way I keep repeating myself, I'm not, right? It's the mother-daughter thing. But where my dad has given me access to everything. Here's view, here's edit. I need all the help I can get, right? So, but that's what we saw with families. And so our platform is very much designed to respect kind of that privacy, even in own families. And then it's been a great utility when we started then thinking about how can we then connect information out in the community? Because Rosa, the thing, especially with stroke, is like, even if the healthcare systems and hospitals share information wonderfully, what we saw is there's this big jump in when they come out in the community. Suddenly you have home care, caregivers. You're going to a special physical therapist because you're paying private pay because the other one isn't doing what you need. And they don't have access to the information. And so we're really empowering families with those records to get the best care, have that story ready, and then to be able to use that information to take care of them, of their family member, the way they want to have them take care of.
Is this when you want to talk about FIRE?
Yes, I know. Don't you love the acronym? So a lot of, well, we'll do 2 minutes. Like, I know, I get so geeky on this. So nurses need to understand. And I know you all felt it because suddenly your families are like, hey, I saw my dad's hemoglobin's back. Like, wait, why do families have access to information? So 2016, a new law went into place. It's called the 2016 21st Century Cures Act. It put in place that these systems have to talk similar and exchange information. Still, HIPAA's kind of in the way of that. But what it also did is it said patients have a right to their electronic information. So if you can't access it from another hospital, you could turn to that patient and be like, do you have a patient portal there? Because they could probably access it before you could because of this new law. And it has teeth, which is which I'm excited about because I'm an advocate at my core, is that when we find an electronic health record vendor and in the future here a provider that does not share information electronically to our patients and family caregivers, we get to file an information blocking claim. And that comes with $1 million penalty if our Office of Inspector General. So I'm really excited about this legislation. I think it's really going to spur the change that we need because it's so frustrating as nurses to one, always be the manual inputter of all the information not flowing between. And two, just watching our families get so lost in the system. And Rosa, that's why I love connecting with you because you get it. That navigator role is just becoming so paramount in our healthcare system. And we have to take a step back and be like, why? And it's just the data isn't following our families like it needs to. And there's just not enough nurses to navigate every single illness. So we're right now doing the most critical. But even then, our patients get lost.
It's so true. Like I had a patient who was in an ER outside of our system with heart problems, and then so I wasn't able to be associated with that chart at all. And I was like, well, did you talk to your primary care provider about it? And they're like, I called and asked for an appointment, and they said they can get me in on Thursday. And what they're verbalizing to me is they're still experiencing these symptoms. And I was like, well, you really need to see if you can be seen sooner. So why don't you send them a message in my chart and let them know what symptoms are happening and that you were seen in the ER and what happened? And she was like, well, that information is in my chart. So wouldn't they call me if they thought I needed to come in today? And I'm like, they have no idea what happened unless you tell them. Like, it's available, but they don't know to look if you
No,
don't
and people don't realize,
tell
yeah,
them.
it's not like populating and alerting. I mean, and maybe one day
Right.
these systems will figure it out, but they don't. Like right now, those systems are meant to just kind of capture the moment and bill your insurance.
Yeah. It is. It's a very fancy cash register, is what it
Yes.
is. And so
Yeah.
we just need to work with it, what it is, and do things like
Yeah.
what you're
And then
doing.
help support our
It,
families. Right.
yeah.
Right.
So I'm
No.
really excited
So,
about
I mean,
that. So, what is your background? Do you have a background in IT?
no. I always tell people I'm the nurse, I'm the non-technical co-founder. So my background is in critical care, which I found like it's always these little critical care nurses in emergency that seem to be like, we can't sit still, right, Rosa?
True story.
And I worked in cardiovascular critical care, floated around the hospital. That was my first thing where I saw the breakdown, right? Because you floating between units and you're like, wait, I saw that guy over here, and what happened to his story, right? So there's internal breakdown.
Yeah.
And then I just became so impassioned with older adults and dementia. Like I just couldn't stand, it just felt like an injustice of how we were treating those patients in the system. Like they can't speak for themselves. They have this poor family caregiver who feels so alone. So I started a company actually in 2015. I called myself a care coordinator out in the community. So my whole role was to swoop in, and I used to tell daughters, you're just hiring another sister, but I'm really smart and I have a lot more time than your other sisters. And I would just go in and I just learned to make a connection. There's so many resources out in our community, but it's so hard to connect them all because you have to really spend time to know what's going on with that patient. What are their financial situation? What are their goals in life? And so me and my nurses, we would kind of developed a workflow. We'd go in, and one of the first things we had to do was collect information. I need to know your meds, your doctors. I need to know your health history, because that data I was using to advocate and find pieces to put in that home to make sure we could keep you in your house. Love that work. I literally had 9 nurses in my kitchen ready to like grow this thing. And that was February 2020.
Oh,
So
man. Oh.
March hits, right? So blessing in disguise, right? I would have never got into technology if it wasn't for the COVID. Oh,
Right.
and March hit, and I remember calling those nurses because we were so excited. And I said, I don't know what to do. I was like, we're going to kill people if we go in their houses, because we didn't know anything, right? We just knew how at risk older adults were. So I closed it down, and but just really reflected. And I kept what really always bugged me during that whole model, Rosa, was one, we were an hourly private pay. We weren't affordable for everybody. And 2, I knew there wasn't enough nurses to scale this across to every family that needed it. And so I knew technology had to be the solution. And so that's where I was just fortunate that I lived in a cul-de-sac and I could walk across my street and I was like, Jim McIntosh, look, this is what I saw. This is a value. I know that there's something to build here. And so we've been at this for 4 years, and it has been quite the roller coaster.
That is incredible. And so, how in the world did you, I don't know, kind of piece this together to start this new business?
Right. So there was a lot of ideas. Like what you see in primary record today is a lot of iterations, a lot of meetings with customers and families. I mean, if there's a nurse out there with an idea, I see this all the time where nurses are just so scared to talk about it because I don't think they want to be told like it's not that it's a bad idea, but you need to go talk to the people that are going to use it to really understand how are they going to use it. And so, that's again where Jim has this technology background. He also has been in product management for startups. So just really helped us kind of start figuring out, okay, who do we need to talk to? So we like made little beta apps and would test things with families. Families would show us their binders, like how do you organize today? What is those things that you wish the healthcare system would do for you? What are your challenges and opportunities, on helping take care of this family member? So we collected a lot of insights. And then we just kept building and changing, building and changing. And then finally felt the confidence to hire our own engineer. And we actually raised money to get this thing started. So we have been live and working with families since December of 2023.
That is so exciting. And I'm so excited to be able to share it with, new people that I'm encountering that are motivated to use it, right? Because some
Right.
people don't see the need. But plenty of those people, the binders, they see the need. And I really love the aspect of you can ask the record, the primary record, what was it the last thing my doctor said about my hemoglobin A1C? And it could
Right.
just like spit out the answer and you don't have to page through a whole bunch of things, right?
Right. That's, we're constantly talking to families. That's like one of my favorites. There are days that are really hard, but my favorite days are when I get to talk to customers. And that's really what I love. I love them explaining, tell me about going to your last doctor visit, because I just see so much opportunity to how to make that experience better for that family. Um, and that's, where we get incredible ideas from our families. Everyone's like, hey, I put this into Google Calendar. Could you integrate this into primary record? I'm like, heck yeah, on the roadmap, and then, it's like just finding out the things that they wish it would do. That's just gold for us, because it's like we have like the initial idea, we've got that power to like integrate the different portals, and there's just a lot more to do in this space. So our team is super excited to work. We're almost up to 350 families on our platform, and I'm just grateful for each and every one of them.
That is awesome. And hopefully it'll get to everybody. And now it has come time for me to ask you a billion-dollar question. Are you ready, Jean?
I am.
And we kind of powwowed about this ahead of time, so you would have an idea. And your answer really surprised me, because I thought I had an idea what you might say. But
I want to hear what you thought.
No. This is about you and what you had to say. So, if you were given a grant for $1 billion, how would you like to see it used to transform healthcare and make a strategic impact on the health of our communities?
And it might have, because I think I spitball a couple answers, and I'm trying to remember what that was, Rosa, but I think just what's been going on these past few weeks has changed me. And I am just so tired of seeing nurse ideas not being invested in, not being considered. Because I really think, I always tell people, nurses, you see the problem, you have all the customer research already. It's just getting the right team and the resources in place for you to take and scale your ideas. So my $1 billion.
What is the barrier to nurses having their ideas invested in?
Exactly. And so that funding needs to go to a place where this was a new world to me. So there are things called venture capital, and they invest in businesses. And what I learned, in pitching my company, how hard it was to pitch to people that weren't in healthcare, that weren't nurses, that didn't understand the problems I was tackling. And I would love it if that $1 billion went to Beth Brooks at her nurse fund, so that she could do all the work. She's already got the model in place. I don't want to create a fund, but I don't have time for that. I'm trying to get primary records. So Beth decided and saw the same issue. So she's got nursecapital.net, and I would give her that $1 billion, and I'd say, Beth, you go find the best nurses and you go invest, and let's solve some big problems in healthcare.
Wow. And I just love that about you, that you weren't just like, I want to have that $1 billion to, it just inflate primary record into going into every home. Like, you saw beyond even the scope of your huge idea.
Oh, because I would definitely pitch my idea to Beth, but
but then if it can grow and fund not only primary record, but also all these other great ideas that touch things that primary record isn't even able to solve. I just love the scope of your vision.
Well, and back to your point, Rosa, it's about collaboration, right? And I really think if we can build this nursing network of ideas and solutions and partnering with each other, just like businesses do today, and really, making commitment to our nursing community, I think that's what's going to, because this whole new model of how they've been doing it forever isn't working. So how are we going to do this different? All right, well, let's get some nurses to the table, and when you give nurses a problem, they solve it.
Right? Exactly.
So, you're doing this has been a pleasure. Oh.
This
I don't know when I'll feel like I've done it, but I always tell someone because someone asked me when do I know this is successful, and I'm like, you know what? It's like if I'm taking my dad to my parent to a medical appointment, and I looked over and someone was on primary record. I think that to me was like, I've made it.
Oh, that would be
It would be so. Yes, like there it is. It's in like that's because that's the dream, right? Putting this in every like hand of any caregiver or family to help support them. That's the dream.
Exactly. And I know what you mean, because after making the Stronger After Stroke podcast, and it's now been like heard around the world, I feel like, all this information that I would have to repeat myself with on the phone as a navigator, educating patients, educating families, encouraging them and connecting them to experts. Now that I've got that information recorded on the Stronger After Stroke
So
podcast,
awesome.
it's out there. They can have it. If they Google it, they can find it. I don't have to be the person to share it with them. And other people are sharing it with other people, and it just grows on its own. And so I think
Love it.
that is a perfect definition of success. It got bigger than where we
Yeah.
started with it.
You just push the little snowball down the hill and now it's doing good out in the world. Like that is definitely
Right.
that is a measure of success. And I'm so proud of you, Rosa.
Well, I'm so proud of Eugene, and I can't believe we are state neighbors. Like, I'm based in Kentucky.
Oh yeah, we're gonna be having dinner soon.
Yes,
We've already got
it's
the
going
place.
to happen. I love it. So, thank you so much for joining me on one of the first few episodes of the Nurse Rosa's Insights podcast. I can't wait to talk to even more people who have great ideas like you have presented here.
Awesome.
And tell us again, what's the name of the woman you would have us invest in?
Yes. So yes, Dr. Beth Brooks. She's at nursecapital.net. And just love her to
Nursecapital.net.
pieces. And she's been wonderful. And then I always tell nurses, like, I will support any nurse on an entrepreneurial journey, like happy to reach out. So you can find me at jean@primaryrecord.com. But if you are interested in using Primary Record for your family, it's a web-based application. We will be in the Apple stores and Google, if Google Play stores still exist by the end of this year. I know, right? So there's all kinds of stuff going on, but we will be available by the end of this year. But you can find us online at primaryrecord.com.
Fantastic. And you can follow me on social media at Nurse Rosa Speaks. And make sure you subscribe to this podcast, Nurse Rosa's Insights, wherever you get your podcasts. And I'll look forward to seeing you in the next episode.
Awesome. Good job, Rosa.